right. So we are a week out essentially from treating your upper jaw, and we had treated your lower jaw a while back. And tell me how it's going.
Going absolutely great. First of all, the lower jaw, absolutely no discomfort. The upper jaw, last week, I think maybe I was uncomfortable for a couple hours, but no real pain. The lower jaw now has the permanent porcelain teeth on there, and I don't even know they're there. And I expect within a few days I'll feel the same way on the uppers. To me, it feels like my natural teeth. And I think it's all just due to Dr. Lemke and his staff that it has come off so well.
And you had thought about doing this for a little while, or?
Yes, for several years. And I think maybe we became aware of the idea of the 1 on 4 and did some investigation, and we knew by sight Dr. Lemke from church. And so when we found out that he was doing this work, that's when we came over here and had a visit, and we were put at ease, both my wife and I, because it's kind of a joint decision, because she says I have her portion in my mouth now. But, and you can edit that out if you want. But, you know, it was well worth it. If I hadn't had the work done, I was in danger of heart disease and other health problems. So it was imperative that something be done, and I just think that having this particular procedure with the implants and the denture sitting on top of them has just worked out excellent for me.
Okay. And you had hesitated, you had put it off for a while just because of concerns, or?
I think we hadn't found the right doctor.
Okay.
And a dentist who did some work and actually put a couple of implants on my lower front many years ago, which were in very well and did a good job, didn't have it set this same way. In other words, I would go in, have teeth removed, get implants, go to another dentist, you know, have something temporary put in, and then have something more permanent. And there would be periods of time when I don't have teeth in my mouth. To me, this was very important because I'm a professional and I like to be able to work and not scare people off. So having this type of a procedure done has worked very well for me health-wise and professionally and personally. And I really thank Dr. Lemke for the work he's done.
You're welcome. How long were you off from work when we did this? We did the surgery, and how long did you take off?
Well, the upper was done last Tuesday. I was back at work Thursday. Actually, I went Wednesday afternoon for a couple of hours.
I couldn't stay away.
Couldn't stay away. And my wife forbade me to stay for more than 2 or 3 hours at the office.
But you could have stayed longer if you wanted,
I
huh?
could have been there all day.
Wow. The next day?
Yeah, the next day.
That's amazing.
Very pleased, and I think it all has to do with a doctor who's performed a number of these procedures and can take care of it, and if it's done properly, then there's not going to be any discomfort. Dr. Lemke has helped me tremendously. Thank you, sir.
Well, you're welcome. Thank you. All right. There we go.